Hey guys, welcome to another video. So today I want to chat to you about what happens in labor. So I want to tell you everything that happens when you're in labor, from the time you start having contractions to the time when you give birth to your baby until after you give birth. What is that whole experience like? What happens? What can you expect? If you want to hear about this, stay tuned. So what happens is that if you go into labor spontaneously, your body is going to go on a slow process, gradually increasing your contractions till the time that your contractions become strong and you are able to give birth. Let's say this is your first pregnancy and you are starting to have your contractions. At the beginning, the contractions might be very far apart, maybe like 30 minutes apart, and they last for a very short period of time. Maybe let's say the contraction lasts for like 10 seconds and then it goes away. So that's how the contractions are. They come and they go. Sort of like they might feel like period pains at the beginning that come and go, and the interval between the contractions at the beginning might be very far, and as time progresses they start to come closer and closer together. And then at some point, let's say you'll probably be having contractions, or let's say you'll be having 3 contractions every 10 minutes now. So at this point you would realize that, okay, now I am in labor, like for real, because these contractions have been constant for quite some time and they are regular. So now you're having contractions, 3 contractions in 10 minutes, so like every 5 minutes, and then maybe at this point your contractions might be lasting 30 seconds. Then as time progresses, they're gonna come closer and closer together. So this period where you are having contractions, we call it the first stage of labor. And in that first stage, we divide it into 2 stages, which is the latent phase of labor and the active stage of labor. So the latent phase of labor is when you are in early labor, like very early labor, and your cervix has not yet dilated past 5 centimeters. So latent phase of labor, it's between 0 and 5 centimeters dilation. The whole idea, or what we really want at this stage when you are in the early latent phase of your labor, we want you to be at home. We want you to make sure you are eating. We want you to make sure that you are hydrating yourself, because this is the time where the contractions are still manageable. You are still able to stay at home, and at this point we want you to stay at home. We only want you to go into the where you'll be giving birth when you are in the active phase of labor. So in the latent phase, we want you to be at home. We want you to be relaxed. You can be doing some exercises here and there, bouncing on the ball, doing all the exercises that you learned at your antenatal classes, but at this point we want you to relax, keep it calm, so that you can preserve a lot of your energy, because you're going to need it when you get to the active phase of labor. So active phase of labor, now things start to get like more intense. The pain starts to become a bit more, and now you start having to like really stop whatever you're doing. Now you can't continue with whatever you are doing anymore. At this point, the contractions are getting painful, like they're really painful, and you just have to stop and breathe with every contraction at this point. And at this point, we want you to get to the hospital, meet up with your doula and your midwife, and go around doing exercises that are going to help baby's head to descend. So at this point now, we want you to be bouncing on the ball. We want you to be squatting. We want you to be doing lunges. And even at this period, we want to make sure that you are keeping hydrated, drinking juice, drinking things like your Energiades, your Powerades to give you electrolytes, because at this point, your body is working so hard and you might be losing a lot of water. So we don't want you to become exhausted. We don't want you to become dehydrated. So at this point, you need all the emotional support that you can have. Between 5 and 8 centimeters, we want you to try and be active. Don't want you to be lying down in bed. Want you to be mobile, keeping upright as much as possible, and hydrating. At this point, you might not even be able to eat anything, but taking sips of water or energy, whatever you are drinking, will be great just to keep you hydrated at this point. And another thing that can happen at this point is that you might start to feel like nauseous and you actually start to vomit. So that's also one of the things that might happen. And your waters might even break now at this point when you are in the active phase of labor. So we are setting the stage now for you to give birth and the baby to come. Now when you're 8 centimeters, the pain starts to get like quite strong and excruciating for a lot of women at this point. Now you really just want the baby to come out. Like you just want the baby to come out. And now at this point, you might start to feel the urge to push. And it's very important that you don't start pushing early before you're fully dilated. Because if you start to push early on, this might cause your cervix to be swollen. And now when it's swollen, it sort of like closes the space around the baby's head. And when you start pushing now, you're going to have to deal with that cervix that's in front. So it's always better to, when you're having those strong contractions, focus on your breathing. Focus on your breathing so that you can try and resist that urge to push the baby out. And then now when you're 10 centimeters dilated and now you can push, now your midwife will want you to get on any position that you want. Now you'll start to feel the urge to push, okay? Your body will tell you what to do. It will tell you when it's the right time to start pushing. At this point, you will be getting on whatever position that feels comfortable to you, whether you are squatting, whether you are kneeling, whether you are sitting on a birthing stool, or you are standing. So guys, you can push in whatever position you feel like pushing it. Whatever feels comfortable for you, whatever you feel like is really helping to make your pushing more effective, we want you to get into that position. So now the contractions are strong and you just fed up, you're getting tired, you're exhausted. The pain has just been going on for what seems like forever. At this point now, you want to start pushing your baby. And then the midwife will keep checking the baby's heart rate, checking if everything is fine with the baby. And they'll be doing vaginal exams to check how far baby is. And at this point, you will now push. And we want you to push with everything you have. We want you to push with all your energy, guys. This is a one time where you are going to have to push for dear life. So at this point, we want you to gather all the energy that you can gather. We want you to take a deep breath before you push, and you push deeply all the way down into your abdomen, and we want you to push for as long as you can push. And then you can take a break to breathe if the contraction is still there, and then you push again. So we want you to push with a contraction because that will help make the pushing more effective. If you don't have a contraction, we don't want you to push. Then you keep pushing and you keep pushing and you keep pushing, and then the birth of your baby, and then your little bundle of joy will be born, and your baby is going to give a great cry. And that's what we want. We want to hear babies cry immediately after baby is born. What happens now after baby comes? What can you expect? Okay, so now baby is here. You have done it. You are such a boss lady. You managed to push your baby out. You managed to give birth to your baby, and it's all on you. You did all the work. Everyone else was there, your partner, your doula, your midwife, they were just there to support you, but you did all the work yourself, and we are so proud of you. So what happens now? Baby is out, baby has cried, and we are happy. So now what happens, as soon as baby's head is out, your midwife is going to give you the baby, and you're going to put the baby on your chest immediately. That's like the first thing that is done before anything else. And then your midwife is going to start wiping your baby and then removing all the wet blankets, because we want your baby to be nice and dry so that baby does not lose heat. And we want to start skin to skin immediately. So after baby is born, baby is going to be put on your chest, dried up, and then put on your chest again. And baby is going to be covered with a blanket to keep warm. And then now you still have the cord connecting you and your baby. So now the cord has to be cut, but because your midwife wants you or wants your baby to have a bit more red blood cells, they're going to delay clamping the cord, maybe for like 3 minutes or so, or until the cord stops pulsating. And then after this, now they're gonna cut the cord, and then you'll be able to comfortably hold your baby now without the cord still connecting you too. And then you are going to be there with your baby. You're happy, you're excited, like you just have that euphoric feeling that is out of this world. You are bonding with your baby. And then your midwife is going to now at this point feel if your uterus has contracted and might give you an injection, an oxytocin injection, to help the uterus to contract even more and for your placenta to be delivered. And then at this point, the midwife is going to deliver your placenta while you are still holding your baby. Once the placenta is out, now that is great. We're happy when the placenta is out, but now we need to check in your womb, is there anything that is left that might cause you to bleed excessively? So at this point now, your midwife is going to expel clots. She's going to put her hand in, and this might feel like very uncomfortable, but this is for the good, you guys, because if there are some products of the pregnancy that are left inside your womb, they might impede the contraction of your uterus, and that might cause you to bleed heavily after birth, which is something that is called postpartum hemorrhage, and it's very dangerous. We absolutely don't want that. So as much as it might be quite uncomfortable for the midwife to put her hand inside your vagina and expel the clots, everything that's left, it will only take a few minutes, and then she'll be done and everything will be out, and then your uterus now can nicely contract back to its normal size and stop the bleeding. And then after that, your midwife is going to check on your perineum. I'll put a picture here of the perineum so that you guys can see what it looks like when there's a tear there. So if you've had a tear while you were giving birth, then your midwife is going to check for the tears and check how big are they, do they need to be sutured, and then if they are big and they do need to be sutured, and you will bleed a lot if they are not sutured, then your midwife is going to suture that. All of this is happening, guys, while you are doing skin to skin with your baby, and then the midwife will suture everything. And then your baby is also getting prepared now to start feeding on your breast, and all the oxytocin that's released when you are bonding with your baby is also going to start preparing your body for breastfeeding. So when your midwife is done now suturing you, she's gonna clean you up, remove everything, and leave you nice and comfortable and clean. So this process usually maybe lasts less than like 30 to 45 minutes, depending on like how big your tear was, but maybe everything will be done after 30 minutes or 45 minutes if you sustained like a big tear. Then at this point, your midwife now is gonna come to you and help you latch your baby to the breast. And at this point, after baby has done a lot of like skin to skin, baby is also like quite ready now. Maybe baby's already been sucking on the skin or sucking somewhere on the hands, looking for the breast as well. Then now your midwife is going to put the baby on the breast and you're going to start the latching process. And the best time for baby to start being put on the breast is within the first hour, which we call the golden hour. It's very important for the baby to get on the breast within this 1 hour so that baby's sugar can be maintained. And also at this point, we want the first thing that your baby is going to feed on to be your breast. We want the first thing for your baby's mouth to try and suck on and latch on, we want it to be your breast. Because if your baby starts to latch, that first latch on something else, it might be very, very difficult, especially now if that is prolonged and baby gets used to sucking on, let's say, a bottle, for example, before your baby can latch on your breast and get used to it. Just because baby latched the first time, or even the first latch might be a bit difficult. It's a learning process even for your baby. So you want to give the your baby ample time to be able to get used to it. So, and at this point also, we need your midwife to also just squeeze your nipples and see, is there colostrum coming out? And if there's a drop of colostrum, that means we're good. We are great. So we want the baby to maximize on that and suck on that breast as early as possible, you guys, so that the body can already start sending a message to the brain that it needs to make milk. Your body needs to produce breast milk. So now baby is going to be put on the breast, and then we want baby to suck anything between 20-30 minutes on the one breast, and then when baby is done sucking on that breast, we want baby to suck on another breast. So if your baby gets that, some babies, they latch immediately. Other babies, it's a bit of like a process, and we need to try and do it a few times. But if your baby is struggling to latch, one thing that can be done during that period is to squeeze some colostrum and then feed the baby that colostrum, maybe through a syringe. At this point, we want your baby to suck. And then when your baby is done now sucking, your baby is probably going to be so tired after this whole process of labor. Remember, your baby also went through a lot, and they're also exhausted after being born. So after that first feed, then your baby now can just relax and sleep. And at this point now, you can also get up from the bed and you can start walking for the first time after giving birth, and you can go and take a shower so that you are nice and fresh and happy and ready for baby's next feed. So, and also now at this point, during that 1 hour of feeding you, your midwife is also going to take your vital signs, check your blood pressure, check your bleeding, check your temperature, and check your pulse. So if you are not bleeding excessively, your blood pressure should be fine, and your pulse, your heart rate should also be normal if everything is going well. And then after the feed, your midwife might also check your baby's sugar to make sure that the sugar is great. And if your baby had a nice feed, then the sugar should be perfect. And then after all of this is done, now you can relax. Now you can eat something at this point because you're no longer nauseous, and you can eat something, you can drink, and then you and baby can just relax and sleep and just recover from the whole process, hopefully. So that's basically how it all happens, guys, from the process of being in labor, pushing your baby out, and what happens immediately after you give birth. So I hope you enjoyed this video, and I hope it helps you a lot, and I hope that you're gonna have a great and positive birth experience. See you on my next video. Bye.